ESTIM is defined as electrical stimulation, which is a form of treatment and therapeutic method of modality that provides proper environment along with pain management and many other forms of treatment to induce proper healing. There are 5 types of electrical stimulation: iontophoresis, or defined as ionto; transcutaneous, identified as TENS; interferential current, identified as IFC; neuromuscular electrical stimulation, defined as NEMS; and high voltage pulse current, defined as HVPC. The first one is HVPC. It is a monophasic electric current that consists of a double peak impulse in the range of 150 to 500 volts. This is the most intense ESTIM, noted to the high intensity of the volts used, but it is counteracted by the short duration in which it is applied to the body. Also, the application and treatment is used for muscle re-education, edema reduction, pain modulation, and wound healing. The high voltage allows for a great stimulation of the cells in the area, but the short duration allows it to not be too impactful to harm the cells as well. This is where the pulse is defined as it goes in and out, and that's what the pulse is defining. This type reduces vessel permeability, allowing them to hold on to plasma. This is why it is good for wound healing. This has relevance in the elderly population who have trouble with healing, along with other acquired conditions such as diabetes and vein ulcers. It also helps in the fight against muscle atrophy. The study that I looked up talked about HVPC and these instances, and it noted that some of the studies were comprised of diabetes foot and venous ulcers. Though in some of the studies were compromised, the ones that weren't compromised, the results upheld the procedure and the outcomes targeted in the treatments. This allowed for people with the diabetic foot and venous ulcers to heal faster and in a more efficient manner than people who were applied with a placebo effect, and we saw a greater reduction of vessel permeability. Iontophoresis. This is the use of electrodes to push drug ions through the tissue. Basically what it does is it takes water-soluble drugs and it directs them into the cells, but it is in a localized area of about 2 to 3 centimeters, and it allows the drugs to be more effective in their intentions, and they don't get lost along the way in reabsorption they don't get lost through absorption through the transportation from site to site. Think of it if you wanted to apply a drug to your foot, and you took it in through your mouth. It has to travel all the way through your digestive system and then along the lines of your blood vessels to reach down into your foot. Where in iontophoresis, you can skip that entire segment and just directly apply it through the body. Contraindications of iontophoresis is scar tissue, drug allergies, the transcranial region, along with the eye region, and people with pacemakers. Precautions involve people with diabetes, pregnancies, over external metal fixation devices. That's other devices like pacemakers, elderly skin, and then people with TMJ. This is good for conditions of plantar fasciitis, temporomandibular disorders, and epicondylitis. The study that I looked up had the use of fentanyl paired with iontophoresis. This was better than the placebo effect and people who had a morphine IV. This allowed patients to heal faster, regain mobility sooner. This helped to offer a safer needle alternative, along with the same effects as that morphine does. This also reduced side effects because of the direct administration to prevent the drug from traveling and decaying as well through the body before reaching ideal effect sites and locations. Ideal effects and the site of location. This also reduced the dependency that is acquired along with the use of morphine when using it in the body. This can be used in instances where people have injuries that that need a muscle relaxer or something like that to allow the body to heal faster, especially like post-operation and different things like that. Next is TINS. This is transcutaneous, and this is used typically for acute pain. The treatment is portable and can be done in self-use scenarios, along with being coupled with cryokinetics. Indications are acute and chronic pain, along with pain with peripheral origin. Contraindications: any person with a heart condition or pacemaker anywhere in the midsection, including, this basically cuts the region between the shoulders and from the hips upwards of the hips, so basically the torso area. And anything, and another contraindication is skin irritation. So as soon as skin irritation becomes an issue, you would want to stop. This can alleviate pain and discomfort by blocking nerve signals. It interrupts the gate control theory by counteracting and interfering with pain. The study outlined that the TINS unit reached desired effects that even others couldn't. Next is NEMS, or neuromuscular electrical stimulation. This helps muscles in aiding with motion along with reducing spasm along with atrophy. Promotes early range of motion post-surgery, but needs to be accompanied closely after with weight training. So basically what it's saying is NMES is not something that you would want to use long after post-surgery. It's just something to get the muscles restarted in their range of motion. And then once you get range of motion, you would want to then switch over to weight training to rebuild strength, because it won't rebuild strength, it just brings back motion. The main goal is to re-stimulate the motor neurons, and that's what it's doing post-surgery. So like people who tear their ACL, a lot of times they can get put in like a straight leg brace or in immobilization braces. So the idea is we want to re-stimulate those muscles so that then they can reactivate them normally. And we're trying to increase that or speed that process up so they're not having to relearn it on their own and then go into weight training. NEMS is very similar to TINS, but is a higher intensity, less duration, and though it can be used with acute, it's majority of the time going to be used for like chronic pain. The study didn't find any conclusive evidence to support MES for patients suffering from patellofemoral pain syndrome. They came to two conclusions on why that was. It was because of mechanical and structural identities of the area. Since the patellar tendon isn't a muscle, the intervention necessarily wasn't applicable to this study and was rather an initial test to see if it held weight in the subject. So basically what it's saying is that this study was done, but it was an initial study to see if it was applicable to this area and to see if they could do further testing, and they found out that it really wasn't valid for the patellar tendon at all. The last form is IFC. This uses 4 electrodes and a crisscross pattern. This is mostly a variation of TINS, but it just changes up the way that the signals are sent and the affected area in those sets. The electrodes are set up in 2 sets, so each set will send a signal to those, and it stays on that same channel. This allows it, though, when a crisscross, to amplify and reach deeper into the tissue. This is for like tissue that is hard to identify what the area of pain is, while also not knowing the generalization of pain. So you see it a lot in like lower back injuries, deep tissue injuries. It can also be used in areas of deep tissue like the quads, the hamstrings, and then it's also used in some like different medical aspects as far as trying to stimulate colon activation as well. This is ideal for really pain relief and spasm, but not as much as the motor stimulation. It's more meant for the pain relief. The study used the study used was for children who had trouble speaking after stroke dysphagia. So basically, they had like the muscles of like their neck and everything, like they couldn't swallow. So anything that allowed them to like activate the swallowing motion, to make noise, anything like that, like they couldn't do it. The treatment after 6 months had countered the inability to speak. There was touch sensitivity for them that went away, and then they were able to make eye contact for longer than 10 seconds. And prior to the study, they couldn't make eye contact at all. This study basically went on to say that even though to get the effects, like it may take time, this is a very effective form, but part of the problem on why it's so like why it takes so much time is because of its non-generalization, and it's more of a widespread systematic effect where like TENS and MEMS and iontophoresis, those are all direct. We know what we're applying those to, where IFC, it's kind of like, okay, we don't know what the generalization is, and we're going to just try and we're kind of just like shotgun shelling it to see if we can hit something that's going to work. The thing that you have to remember is that ESTIM is not a cure. It's just something that helps induce a healing environment. I believe that it is a very good tool to help in the aid of modalities and in healing. But as you could tell with like some of the variations, there can be too much of something. So the thing to remember is that the body is always its greatest medicine, and that ESTIM is good. It's just an aid to help people get better.